So as technology becomes more sophisticated and artificial intelligence plays a larger and larger role in what we do, I see definitely that radiation therapists are going to need to be at the table to have to be able to influence the shape that technology will take moving forward. And I think we're starting to see that, especially in the artificial intelligence world. And again, with the focus being on patient and person-focused care and precision medicine, it really behooves our profession to stay and improve and increase our integration into the patient care realm. To be focused on our patient is primary. We have to be patient-centered, and not just to have that on the mission statement of our cancer centers, but to actually embody it and really understand what that means. So I see moving forward into the next decade and beyond that radiation therapists are going to have a more scientific background in order to understand the biological processes, the molecular processes that go into learning more about predictive outcomes. They're going to have more scientific knowledge around interactions with immunotherapy and different chemotherapy agents and how that exacerbates or could exacerbate radiation therapy side effects. So I see education becoming more rigorous, more robust in the scientific way. I see graduate programs are going to be necessary in order to prepare practitioners to take on different roles that we've probably not even envisioned yet. So roles that bring the research from the petri dish or from the bench, the scientific bench, to the treatment couch. And so that translational research, I think, is going to be paramount. We're seeing more and more therapists getting involved in research, and that's very heartening to me. I see that being a very beneficial foray for the profession, and to have some more evidence and further evidence to base our decisions on clinically. So I do see that in the next decade, we are probably going to see practitioners that we didn't even conceptualize today. And that's a good thing. I also see advanced practice roles that maybe we've not envisioned today. And so that advanced practitioner being able to work in a more autonomous and practice in a more autonomous way. Certainly other jurisdictions within Canada have embraced the advanced practice model, and I do see the rest of Canada starting to move in that direction as well. And so in 10 years, our landscape in the advanced practice world in radiation therapy may look very different. And again, that's a good thing.
In my opinion, AI or artificial intelligence is the next significant innovation, and I think it will help supercharge many aspects in the field, such as safety, efficiency, accuracy, and sensitivity, not only in the MRI, but in all other modalities as well.
There are some things that are evolving more in the medical management of patients with epilepsy, but that's not our field. That's how our patients are taken care of by the physicians. But the field itself, other than in the land of the field of intraoperative monitoring, I think there's lots of advancements happening with that. But that is a very small part of what we do, and there aren't not a majority of EMPs do intraoperative monitoring. So in EEG, it's really some of the medical management of patients that we're seeing lots of changes. The one thing that is changing is with surgically implanted electrodes are surgical evaluations of patients with epilepsy. That's not intraoperative monitoring. There are some advancements in the types of surgeries that are available, less invasive surgeries. So I'm really interested to know moving forward if there will be investigations we can do with stereotactically guided electrodes, if there will be more and perhaps better ways of guiding those electrodes so that you can be more discreet about finding the abnormal focus in a particular patient. So any of the work that's done with these surgically implanted electrodes is exciting, because with people that previously their lives have been ruined because they can't move forward when they're having seizures uncontrollably, maybe it'll offer more opportunities surgically for more patients so that they can lead a normal life. So that's exciting, what they're doing with the stereotactically implanted electrodes. So yeah, hopefully that'll move forward and there'll be more and more of that.